Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 922681060. My dear friends, today's topic is related with the skin disease. And in Ayurveda, in Sanskrit language, it is called as Vipadika. Yes, please wait. I am going to explain you what do you mean by Vipadika in Sanskrit on Ayurvedic terminology. So here you can see, this is the palm, this is the foot, and this is the plantar aspect, this is the palmar aspect, and here you get some skin problem that is a kind of psoriasis. So this is like a palm and plantar psoriasis, which in Ayurveda can be compared with Vipadika. And the best medicine you can see over here, Panchatikta Ghrita Guggulu. The link for getting this medicine is available in the description. My dear friends, do you, particularly you or someone you know, suffer from painful cracking skin on the hands and feet? Maybe symptoms like severe dryness, itching, scaling, redness, and even bleeding fissures. Then today we are diving deep into an Ayurvedic perspective on a condition called as a Vipadika, which can be closely related to what modern medicine called as Palmoplantar Psoriasis. Vipadika, Palmoplantar Psoriasis. Vipadika is described in the classical Ayurvedic text as a type of Kshudra Kushtha, meaning chronic skin condition, primarily affecting the palm and the soles. It can significantly impact daily life and, of course, the quality of life. In this video, we will explore what Vipadika according to Ayurveda, how it can be correlated with palmoplantar psoriasis, the Ayurvedic understanding of its causes and the development, a fascinating case study which is published in the Journal of Ayurveda and Integrated Medical Science, showing how the Ayurvedic treatments can help to the patient of Vipadika or psoriasis. The specific treatment used and the impressive results seen in just 3 weeks, we are going to see that results. Important dietary and lifestyle advice from Ayurveda for managing such type of the conditions. But of course, my dear friends, as a disclaimer, I must tell you the video is for informational purpose only. The information presented is based on Ayurvedic principles and a specific case report. It is not a substitute for professional medical advice. Always consult a qualified healthcare provider or an experienced Ayurvedic practitioner for diagnosis and treatment of any health condition. Do not self-treat based on this information. So, what exactly do you mean by Vipadika? Ayurveda describes it with some key symptoms. Number 1, Pani Pada Sputana. I am giving you both Sanskrit knowledge as well as the modern comparative terms. So, fissure or cracks on palms and soles. Then, there is a Tivra Vedana, severe pain sometimes. Then, Manda Kandu, itching. Then, Sarag Pidika, red patches or the eruptions. Sometimes there may be dah or burning sensation. This clinical picture strongly correlates with palmoplantar psoriasis, a chronic inflammatory skin disorder affecting palms and sole, often presenting with thick, scaly, red plaques that is hyperkeratotic or sometimes pustules. Modern medicine acknowledges This particular condition is challenging to manage, often involving corticosteroids or immunomodulators, with recurrence being common. Psoriasis affects a significant number of people, and the Palmoplantar variant makes about 3 to 4% of psoriasis of all the cases. How does Ayurveda can explain the cause? The important key factors like Viruddha Ahara. If the person is consuming consistently incompatible food combinations, like for example, milk and the fruits together, that is fruit salad or milkshake, this is Viruddha Ahara. Unhealthy diet, that means excessive liquid, fatty, and heavy to digest foods. Vegadharana, suppressing natural urges like urination, defecation, hunger, thirst, sleep, etc. Improper lifestyle, asatmya vihar. But there are important factor is mental stress, that is manasika bhavas. These factors together believed to aggravate the body's bioenergetic principle known as doshas, particularly Vata and Kapha dosha imbalance. This imbalance affects first digestion, that is Agrimandya, disrupts the tissue like Rasa, that is plasma, Rakta, that is blood, Mausa, that is muscle, and Ambu or Lasika, that means lymph or water element, and ultimately manifest in the skin or the thwak of the hands and feet. Although Vata and Kapha are often predominant, Ayurveda consider all skin diseases, Kushtha, to be ultimately caused by imbalance of all the three doshas, that is, three doshaja. Now let us look at the case report published in Journal of Ayurvedic Integrated Medical Science. A 42-year-old male patient visited in the Kaya Chikitsa, that is internal medicine OPD. Patient complaints were number one, dryness, itching, cracking, and scaling on both feet, hyperpigmentation, that is darkening of the skin, bleeding from the cracks. This had been for last 6 months. The patient experienced continuous pain and itching throughout the day. There was also watery discharge from the cracks. The lesions were symmetrical on both the feet. The patient had no significant past or family history of such type of the condition. When the doctor examined, that reveals there is anxiety, there is a loss of appetite, constipation, coated tongue, and disturbed sleep. The diet included was spicy and oily foods. Based on the symptoms and Ayurvedic examination methods, that is Dasha Vidha Pariksha or Ashta Vidha Pariksha, assessing the constitution, current imbalance in the bioenergies, the condition was diagnosed as Vipadika with Vata and Kapha predominance. Modern examination noted erythema, that is redness, hyperpigmentation, dryness, scaling, fissures, and tenderness. The treatment focused on Shamana Chikitsa therapies aimed at pacifying the aggravated doshas and alleviating symptoms without aggressive detoxification or panchakarma. This involved both internal medicine, that is antah parimarjana, Sanskrit word, and external application, that is bahi parimarjana. Here, let us see what was administered. Number one, Mahamanjisthadi Kwatha or the kadha or decoction, 15 ml taken orally twice a day before food with lukewarm water. That means we can explain that this is a classical decoction known for the blood purification, that is Rakta Shodhana, balancing Pitta and Kapha, reducing the excess moisture, that is Kledha Shodhana, and acting on the skin, blood, and muscle tissues. Manjishtha plant is itself key herb for the skin health. Next medicine was Panchatiktaka Ghrita Guggulu, the 500 milligram tablets orally twice a day after food with lukewarm water. This formulation combines 5 bitter herbs, that is Pancha means 5, Panchatikta, Tikta means bitter, with Guggulu in a medicated ghee base. The bitter taste is excellent for the skin conditions, reducing the itching, that is Kandu, and inflammation. Guggulu helps target deeper tissues and metabolic waste, that is Kleda. Next tablet was Arogyavardhini Vati. Vati means tablet. 2 500 milligram tablets orally twice a day before food with lukewarm water. A very famous formulation, literally Arogya and Vardhini, promoter of good health. This acts as a digestive, that is Deepana Pachana, clears the body channels, that is Srota Shodhana, helps to eliminate the toxins, that is Malashuddhikara, and is specifically indicated for skin diseases because this is Kushtagna, okay, or Kushtha Nashakar. This Arogyavardhini helps to reduce tiredness and the pain in Vipadika. Next medicine, internal medicine, Gandhaka Rasayana. 125 milligram tablet orally twice a day after food with lukewarm water. This contains purified sulfur, that is Gandhaka, processed with various herbs. Sulfur is renowned in Ayurveda for skin conditions. It is considered as an antimicrobial, that is Krumi Nashak, anti-inflammatory, that is Dah Nashak. Parallel Sanskrit words, very interesting. Blood purifying, that is Rakta Prasadana, and helps to reduce the exudation, that is Kleda, due to the drying properties. Then there is a Jivantyadi Yamaka, applied externally. This is externally in sufficient quantity to the palms and to the sole. Yamaka means a combination of 2 types of fats, often ghee and oil. This formulation contains herbs like Jivanti, Daruharidra, Manjishta, etc. in the base of ghee and sesame oil. Jivantyadi Yamaka. This is designed to counteract the dryness, that is Rukshata will go due to anxious nature, that is Snigdha Guna, promote the wound healing, that is Ranaropana, reduce the cracking, that is Padasputana, itching will be reduced, Kandu will be reduced, pain or Vedana will be reduced, and burning or Daha will be reduced. Then there is a Siddharthaka Yoga Kashaya. Siddharthaka Yoga Kashaya used for external washing of the palm and sole, that is Parishek. This is a decoction used for washing the affected area. It is considered effective for the conditions with Vata Kapha predominance, possessing properties that fight the skin elements, that is Kushtagna, and relieves the itching, that is Kandugna. So, did this comprehensive Ayurvedic approach help to the patient? Yes. Look at the results reported in the study over 3 weeks treatment. The researcher tracked key symptoms using a scoring system 0 for none and 3 for severe. For example, Padasputana cracks started at score 3, severe complete foot, that becomes reduced to 2 after 2 weeks, and down to 1, cracks only on heels after 3 weeks. What about the Vedana or the pain? Started at score 3, severe constant pain, it reduced to 2 after 1 week, 1 after 2 weeks, and remarkably down to 0, that is no pain after 3 weeks. Oh, what a great result. Kandu, what about Kandu or itching? Started at score 3, severe disturbing sleep, that much Kandu itching, reduced to 2 after 1 week, 1 after 2 weeks, and 0, no itching after 3 weeks. What about the Daha? Daha, that is burning sensation, started at score 2, continuous burning, reduced to 1 after 1 week, and down to 0, no burning after 2 weeks. The patient showed substantial improvement with a marked reduction in symptoms within 21 days. This suggests that this Ayurvedic protocol was effective in managing Vipadika in this particular patient. Ayurveda strongly emphasizes the treatment is not just about medicines. Nidana Parivarjana, avoiding the causative factors, and adhering to Pathya Ahar Vihar, that is wholesome diet and lifestyle, are very crucial for managing the condition and preventing the recurrence. So what is recommended pathya for this patient or any psoriasis patient? Diet should be light food, laghu anna, bitter vegetables, tikta shak, aged grains, that is purana dhanya, meat soup from arid land animals like dangal mouse, mung beans, that is mudg, pointed gourd, that is patol, specific aged rice varieties, that is purana shali, chashtik shali, barley, that means yav, wheat, that means gothum. Ghee prepared with herbs like triphala or neem is better to consume. Drinking water processed with khadir, catechu or neem, it is better. Medicated buttermilk, that is aushadh, Sanskrit takra, is also beneficial. What should be avoided by psoriasis patient? That is apathya. Heavy food or guru anna? No. Sour taste amla rasa food? No. Milk, dugdha, yogurt, that is dahi, fish, that is matsya, jagari, that is guda, sesame, that is tila, heavy metals, excessive oils? No, no, no. Irregular eating habits like eating before previous meal is digested, that is adhyasana or ajirnashana? No. Foods which cause burning sensation, vidahi, or block the channels, that is abhishandi, don't take that type of food. Lifestyle. Daytime sleep, diva swapna, sexual indulgence, that is maithuna, suppressing natural urges, that is vegadharana, this should be avoided. Unethical action, that is papa karma, believed to have the karmic, what you can say, the repercussions on the health. Excessive exposure to the heat or sun, that is tapa sevana, no. Sweating therapies or svedana, no in psoriasis. Walking barefoot, excessive walking, exposure to the mud, dust, excessive water, and the winter season, which can aggravate vata and kapha, avoid it. This case study provides a hopeful glimpse into how Ayurvedic principles can be applied to manage challenging skin conditions like Vipadika or Palmoplantar Psoriasis. The multifaceted approach addressing internal imbalances with oral medications, soothing the skin with external applications, and emphasizing crucial dietary and lifestyle changes led to significant improvement in symptoms within just 3 weeks for this particular patient. So, what is the take home message? Vipadika is a chronic skin condition recognized in Ayurveda correlating with Palmoplantar psoriasis. Ayurveda attributes it to the doshic imbalance, mainly Vata Kapha, triggered by a diet, lifestyle, and stress. A structured Ayurvedic treatment plan involving specific internal, that means Kwatha, Vati, Ghrita Guggulu, Rasayana, and external, that is Yamaka and Parisheka therapies showed promising results in this particular patient. Diet and lifestyle modifications, pathya and apathya, are considered fundamental for long-term management and preventing the relapse. Once again, please remember that this is based on one case report and traditional Ayurvedic knowledge. It is essential to consult with qualified professionals for your specific health problems. Ayurveda treatment is highly individualized. If you found this video informative, please give thumbs up. Subscribe for more content on Ayurveda and holistic health, and share it with your anyone who might be benefited for this particular Vipadika or Palmoplantar psoriasis. Let us know in the comments if you have any questions or experiences to share. Thank you for watching, and I wish all the best. Take care and see you in the next our interesting video.